different way. There's an attempt to get rid of Social Security. There's many ways to get rid of Social Security. It's been tried essentially since what 1935, 1937 was the first big push. But many different methods, privatize right out. That's been tried several times since the very beginning. Again, in the 1980s, there was another attempt. Raise the retirement age, which effectively reduces your benefits because when you retire it early at 62, you get even less than 30% because if they raise the retirement age to 69 or 70, an outright reduction or cut of benefits, inaction. That seems to be the one that's currently going on right now, unfortunately, is inaction to solve the issue of Social Security for the next generation and beyond. But the method that we're going to talk about today is making it hard or basically impossible to get your benefits. So that is an attempt to kind of chip away at the program that is happening. Just started last week, last Thursday, and we'll talk about that. And if you say, okay, well, chip away at the benefits, make it more difficult to get your benefits. A lot of people out there say, well, I've already gotten my benefits, already get my check, so I don't, it's okay. I don't really care. But the reason you got your check and hopefully your children get their checks is because you and your parents and your grandparents took action when necessary to make sure the Social Security system has still been here since 1935. So they did their part, and we need y'all to do your parts today as well. So what do we have? The House Appropriations Committee voted along party lines last week to cut Social Security Administration's budget, the administrative budget, by close to $500 million. And for anybody out there that knows, they're about to file for benefits, looking to file for survivor benefits, they got an overpayment, filing for disability, or whatever the case may be. Customer service is extremely bad. Right now, we're looking at customer service the worst in terms of staffing at Social Security, the worst in 27 years. As regular viewers know, I ran the third busiest Social Security office in the country, and we could never keep up. The staffing was extremely low. The computer system wasn't that great either, but we just didn't have enough staff to do what we really wanted to do to help customers. And if this budget passes, so it went through a committee, and they're talking about $500 million cut in Social Security. So it's definitely going to reduce staffing. They might have to cut back the hours of when they're open. There's going to be delays on pretty much everything. And unfortunately, what happens on a lot of this is people get the wrong information. There's not enough staff there. And this is kind of what I am doing in my semi-retirement. I am doing these live Q&As. And if you're just sticking around here for the, want to hear about the topic, I'll be done with the topic here in probably a few more minutes. And then I'm going to open it up as I usually do at this time and answer all your questions, because Social Security, unfortunately, doesn't pick up the phone, and you're getting multiple answers, and people are losing a lot of benefits. We found tens of millions of dollars of benefits every month through this channel. People get the benefits they're entitled to, didn't know they were entitled to benefits. And so we'll do the live Q&A. A lot of people are losing benefits. There's tricks around to that I've talked about, protective filing, that will get you the benefits because of the delays of Social Security. If you call Social Security and they don't get your check in time, don't start your benefits. Make sure you join my live Q&A. Make sure you watch my videos so you know how to kind of make an end run around that. But people are getting the wrong information, and they're just walking out of the Social Security Administration, out of the office, and they say, well, I guess I'm not entitled. And then they go on with their lives, and they don't realize until a year, 2 years, 5 years later, until they come on the channel here and realize, oh, wait a second, I could have gotten benefits a year, 2 years, 3 years ago. So they're losing benefits. People are switching from widow's benefits to retirement benefits. They don't know there's more money on retirement benefits. Wait longer for disability. People have a problem with overpayments. They just passed a new regulation on overpayments that we've talked about. And if you're currently receiving benefits and you're good, and you're just like, well, customer service doesn't matter to me, Well, what happens if you get an overpayment? What happens to your survivors when something happens to you and your survivors have to file for benefits? So, and all of this is essentially meant, as I said, there's many ways to destroy Social Security. One of them is just, get rid of it, privatize it, hand it over to Wall Street, cut your benefits, raise the retirement age, and all the rest of it. But another way, those direct approaches, I'm old Marine Corps sergeant, so those direct, attacks, um, don't seem to work. That was tried several times. So the new tactic is kind of to do an end run and deteriorate customer service and deteriorate confidence in the system by continuing to say, well, the money's not going to be there in the future. It's given to immigrants or Ukraine or stolen. Watch my videos and I explain all of the details. I just did another one yesterday on that, try to destroy some of these internet myths. So this is this new strategy we need to watch out for. And how do you address this to make sure the customer service and people get the benefits they're entitled to, know about the benefits they're entitled to? Well, all politics are local. As I always say on this channel, even in my district, I'm sure in your area as well, you've got your federal politician, your two senators, and your House representative in your particular district, and there is a Social Security district office there. And if your line outside of the office is just crazy every single day, like mine was at my office, and they just don't pick up the phone or they don't, help you, then I would call those politicians and say, hey, you're more than happy to go out there and put a hard hat on when you build a new bridge or a new, highway in your district, but put a hard hat on and go to the local Social Security office and make that customer service better. Because all politics are after local, and that is their responsibility. Those particular local offices are the responsibility of those federal officials, your representatives. So make sure you contact them and say, hey, improve the customer service in our area. All right. So this is, again, extremely important that you take some action and get this done. And so the customer service stays and people get the benefits they're entitled to. But in the meantime, because people are not being made aware of all the benefits out there, let's go ahead and get into some questions and answer all your questions. All right, Wiley Coyote. Dr. Ed, did I hear you correctly the other day? I should receive a packet 100 days out of turning 65 for Medicare. Also, what's the average wait time for Social Security to start after applying? Okay, yes, about 100 days. That is if you're currently receiving Social Security benefits. If you're currently receiving Social Security benefits, then your Medicare will start 100 days before your 65th birthday. You'll get the packet in the mail. So it's important that Social Security has the correct address because that's how Medicare gets your address as well. So 100 days before. However, if you're not receiving Social Security monthly benefits, then you actually have to go in there and actually file for Medicare. And remember, we're talking to Part A, that's free for most people. That covers the hospitals. Part B is the medical. The doctors, that's this year's $174.70. If you're not receiving benefits, then you'll have to make arrangements, usually pay it on a quarterly basis. But if you have health insurance from work and you like it, your work or your spouse's work, and your employer has 20 or more employees, you do not have to sign up for Medicare if you don't want to. You can sign up for A, it's free, but unless you're contributing to an HSA, a health savings account. If you're contributing to a health savings account and you start Part A, then the IRS is going to have issues with you. But if not, yeah, you can go ahead and sign up for Part A. And then once you stop working in the future, year, 5 years, you or your spouse, then sign up for Part B at that time. No use in wasting your money. How long does it take? Depends how you filed. If you did a phone appointment and you just filed for regular retirement or Medicare, I've done hundreds of thousands of those. The retirement or Medicare application, takes 10, 15, 20 minutes. If everything is good, your residency, your citizenship, your earnings record are correct. Usually took me about 3 minutes to push the button and adjudicate that after the interview. So it's pretty quick. Let's see. If I want to start collecting my retirement in January, when should I put in for it? Yeah, that's usually the busy time of the year because everybody wants to start their benefits starting January. So around October or so, call up. September, call up and schedule an appointment. October, November, December, or you can go ahead and file online. Pretty easy. Let's see here. Um, okay, you're receiving SSI. Yeah, SSI is $943. There is a proposal, some proposals out there to increase benefits across the board, and yes, there is part of that plan is also to pay for it as well. So I'm going to talk about the within the week. I'm going to talk about, since we have a new presidential nominee contender. I did one comparison, Social Security and Medicare, between Biden and Trump, and give you, again, my experience and kind of my expertise on Social Security and Medicare and their particular plans. And now that we have a new person in there, Harris, I'm going to talk about the compare and contrast the two, so you can make a decision if Social Security and Medicare are important to you. Let's see. It seems like Trump is already infiltrating the system. Okay, yeah. Let's see. They should fire the female. Okay, let's see here. See if we get any questions. Then they can give us our money we put into it. All right, yeah. So as I talked about, every single penny that was put into the trust fund is still present and accounted for. All the money is still there. You have to just read the trust fund report, the trustees report. The problem is that the demographics, less kids, more money going to the top, which they don't pay into Social Security. That's the issue. But all the money that was paid in there is still there. Oh, Eleanor, thank you very much. That was a Republican majority House vote. All right. So thank you very much for the coffee money. I appreciate it. Thank you. Thumbs up. Ed's videos need to get out. Everyone, hit the thumb. Yes, please. That's how we teach this stupid YouTube and TikTok and Instagram algorithm and all the rest of it. How that people need this information, and we find money for people every single day and make sure they're getting their benefits they're entitled to. And as I always say, I came out of retirement to do this, to make all these videos, but you should be able to get all this service at Social Security. But unfortunately, that's not happening. So I will keep doing this until Social Security steps up and does a better job. Is my great granddaughter that is autistic and has focal seizures several times a day entitled to Social Security? Okay, a they really need to add those benefits. There's so many grandparents that are taking care of grandkids nowadays. They really need to add that. But as if you adopt the child and you're receiving retirement benefits or disability benefits, then yes, a child or a grandchild can get benefits off of your record, 50% of your primary insurance amount. Um, or if their parents are disabled or deceased, then they can get benefits based on those records. So, but unfortunately, just if you don't adopt your granddaughter, then unfortunately, great granddaughter, I'm sorry, great granddaughter, then unfortunately, yeah, there's no more money for. But there are. Before I worked at Social Security, I worked with the Department of Social Services. Check the Department of Social Services in your particular area. It's called a non-needy caretaker. So if you're taking care of that child, and there might be some money out there, because states throughout the country said, if you weren't stepping up and taking care of your grandkids and great grandkids, then the state would have to do it. So the states are saying, we'd rather have it, have the child stay in a relative's home. So it's called non-needy caretaker. You don't necessarily need the money yourself, but because you're taking care of a child, a grandchild, or whatever, then there's some funding there. So I would definitely check it out. Again, non-needy caretaker. But in terms of Social Security, unfortunately, no. But autistic, the child can file for SSI themselves, but not from you, themselves. It's called Supplemental Security Income. It's not Social Security. It's administered by Social Security. It's a welfare-based program. So definitely check out that. And if the child is determined to be disabled, that's how you can get SSI. SSI, the supplemental security income, you get a welfare needs based, low income, low resources. You can get it based on disability or aged, 65 and older. And the max you can get, as someone was just saying, is $943 a month. But definitely try that, and non-needy caretaker. Imaginator, hey, what's up? Thumbs up as well as subscribe makes a lot of sense if you're confused with the whole Social Security. Yes, thank you very much. Got an awesome community out there that's always looking out for everybody else. Does raising the retirement age affect people turning 62 and above, or is this for future generations? They haven't changed it yet. So, well, they changed it in the 1980s on the Greenspan. So it used to be, 65. Now it's 67 for anybody born after 1960. And if they raise the retirement age, then usually what happens is right now, if you file for benefits at 62, then it's about 30% reduction. So if they raise the retirement age to 69 or 70, then it's going to be more of a reduction. So if you need that money, then you're going to get less, or you have to wait until you're 69 or 70 or whatever it is. So it's basically a benefit cut for those people that need it. And it's always the people that always advocate for raising the retirement age have nice, cushy desk jobs. Like I had for quite a few years working at Social Security. Hey, that was a desk job. Marine Corps was a different situation. But yeah, it's, my father was a long distance truck driver. Mother worked at a breakfast diner. Those are jobs you just can't do at, 65, 69, 70, 70, it's just, so it's the people that have those easy jobs that want to raise the retirement age, or they don't even need the money. So things need to be done to solve Social Security, but cutting the budget and raising the retirement age and all the rest of it are not. I've done several videos on my ideas on how it should be done. But yes, please. Thank you, Kathleen. Let's see. Yes, these two. She should be on Social Security disability. Yes, definitely. SSI. Tell her great granddaughter, call up, schedule an appointment, Social Security, and file for supplemental security income based on disability. So thank you, Stu. Appreciate it. Hit the like button. Yes. Ginger, you're on SSI. You should also be receiving SNAP and Medicaid. Yes, Deb. What an awesome community. Yes, if you are on SSI, again, welfare-based program, then you're what's called categorically eligible for Medicaid. So Medicaid is administered by the state. If you're receiving SSI, you're not entitled to Medicare. Medicare, you can only get, that's what you pay your FICA taxes for. You pay your FICA taxes for Social Security and also Medicare. But you have to actually have paid into that system, or your spouse or had to pay into that system. But SSI, yeah, you don't get Medicare from SSI, but you can get Medicaid, which is administered by the state. So you go down to the state and you apply for Medicaid, and sometimes states will just go ahead and pay for your Medicare that you're not eligible for free on your own. Some states say, well, it's cheaper just to pay for this person's Medicare. So make sure you check that out. And then yes, SNAP benefits, food stamps, and yes, a lot of other benefits out there. And watch my video. I did a video on living on Social Security alone, and I covered about over 49 different programs, financial assistance, college courses, dental, electrical assistance, and all of them. I just updated it. I've got 4 videos that the introduction's way too long, so I just kind of abbreviated and turned it into a 17-minute video that I go through the entire list pretty quickly. So make sure you watch that and grab a little piece of paper and a pen and jot down, oh, that might be good for me. That might be good for you. So let's see. Katie, Dr. Weir, my wife started collecting Social Security at 62. She is 70 now. I'm 68, working full time. Currently, she gets $14.72 a month and can get more claiming against my earnings. How do we switch? You have to file for benefits on your own record because y'all are married. So she can't file for spouse benefits until you file. But Her benefit amount is 1472. She started collecting at 62, so her full benefit amount is probably close to $2,000. So she's probably not going to be able to get spouse benefits because her full benefit amount, not the 1472. That's because she filed early. Her PIA, her primary insurance amount, has to be less than half of yours, and nobody in the country has a PIA that much. The most this year is around 3,800. You are your benefit amount, because you're 68 and you haven't started yet. Um, you're going to start getting those delayed retirement credits. You're already getting those delayed retirement credits if you haven't filed. But they don't look at that. Current living spouses don't receive those delayed retirement credits. Surviving spouses do, though. So if anything happens to you, then she will essentially get what you were receiving if your benefit amount is higher. Um, let's see. That's not true. My hubs is on SSDI. We cannot qualify for Medicaid or SNAP because he has a retirement fund. Yeah, yeah. Again, Medicaid is a welfare-based program, so they look at income and resources. And SSDI is not SSI. SSDI is SSDI, so Social Security Disability Insurance. SSI is a welfare-based program, and yes, if you're getting SSI, then that's all you're getting. Then you're going to get Medicaid. I must be an outlier. Got excellent help from my local Social Security office. That's what I like to hear. Yes, I think my office provided awesome service as well. But we could have done a lot better, a lot quicker, but good. Let us know what office that was. I always like to do shout outs for good offices that do the right thing. I was thinking about applying at full retirement age, but still working full time. My yearly income will go up this year, so will my Social Security benefit go up because my income went up? Yes. So if you're going to file at your full retirement age, work doesn't matter. It's not going to be $1 for every $2 you go over an amount and all that kind of stuff, because you're going to be your full retirement age. But yeah, your benefits can go up for several reasons. Obviously, a COLA increase. And also, if you continue to work and continue to pay into Social Security, which you always will, you always get to FICA taxes, even when you're collecting benefits. And if that's one of your high 35 years of earnings, because that's how Social Security determines your benefit amount, by your high 35 years of earnings, then what happens is once you file your taxes, the IRS notifies Social Security, and Social Security looks at last year's earnings and they say, hey, this is one of this person's high years. Let's kick out the low one, stick this new one in there, recalculate, and increase your benefit. That is 100% automatic. You don't have to do anything other than file your taxes. All right, let's see. You got some other. What happens to the money of all the folks paid into Social Security if they died from COVID? I am going to do that. It goes to watch my video. I'm going to do a video probably tomorrow, or the next day, on a 16,000% return on investment. So watch that one, and I'll go into more detail. I've been on Social Security disability for 3 years, heart problems, loss of foot, and Social Security keeps trying to send me back to work. I don't understand. Social Security doesn't try to send you back to work. You can go back to work, but they don't, try to send you. I've never heard of that. They do what's called work CDRs and medical CDRs. This year they've postpone the medical CDRs for the rest of the fiscal year. That's a review to make sure you're still disabled. But yeah, if you work, you can work. Watch my video I did on Social Security, working while receiving Social Security disability, working while receiving SSI. Basically, you can work. You've got that 9-month trial work period. You can make as much as you want. After that, you've got a 36-month extended period of eligibility where every month you go over the substantial gainful activity, which this year is $1,550 a month. Then they'll stop the check for that month. But yeah, Social Security never, tries to, tells you to go back to work necessarily. They just determine whether your disability is preventing you from working. So probably when they do the medical CDR, if they determine that you are better now and your disability no longer limits your ability to work, then they won't tell you to work. They'll just won't give you benefits, unfortunately. But you can always appeal that. I am 61 on SSDI. At 67, do I need to convert to standard Social Security? Nope, that is all 100% automatic. Basically, what happens once you hit your full retirement age, if you're on Social Security disability, your benefits automatically switch to regular retirement benefits. And nobody notices because it's just a bureaucratic thing where they stop taking your Social Security money out of the Social Security Disability Trust Fund and they start taking out of the retirement trust fund. And the check stays the same, direct deposit stays the same, and everything. But you're now free. You don't have any CDRs anymore, medical CDRs or work CDRs. There's no limitations. You don't have to tell Social Security that you're working. You don't have to stay under the substantial gain for activity. You're no longer on disability. You are 100% free. But if you're 61 now, watch my video I did on receiving disability and when you turn 60, 62, 65. When you're on disability and you turn 60, if you're eligible for any spouse benefits, you can start spouse benefits, and that won't affect your disability. When you turn 62, see if you're entitled to any spouse benefits. 60 is surviving spouse, 62 is regular living spouse benefits, 62 spouse benefits or divorced spouse benefits. Again, you can continue to receive your disability and extra money from that. And then when you're 65, in most states, all you could have gotten was a Medicare Advantage plan. At 65, you're in a new window where you can get a Medicare Supplement plan if you want, if it works for you, and you can't be denied and you can't be charged extra. So 60, 62, 65, there's things that you need to do to make sure you're getting everything you're entitled to. Because remember, all those decades of paying into FICA, that's what it's there for. Can I file online for my benefits if I'm getting survivor benefits now? Okay, so it sounds like you did it right. I like it. So you're getting survivor benefits and you didn't touch benefits on your own record and you just let your benefits on your own record increase while you're collecting survivor benefits. Good, perfect, good strategy. And you should be able to go in there and file for retirement benefits on your own record. You can't do survivor benefits, but you should be able to do it on your own. But if not, just call Social Security, set up an appointment. And then if you're 70, that's when your benefits on your own record max out. So don't wait till after 70. And if there's more money on your own record, then yeah, jump over to it. But if you're like, 68 or 69, then at that time, when you call Social Security and say, okay, hey, if I start my benefits on my own record today, how much is it going to be? And then say, okay, well, if I wait a year, how much is it going to be? And then, compare and contrast, make sure you're getting everything you're entitled to. My son has been waiting forever for Social Security disability. It has been over 2 years. Wow. Yeah, that's way too long. So that means you are in the third stage. You filed for disability, or he filed for disability, the initial, he was denied. And then you filed a 561, a request for reconsideration, denied. And then I'm assuming, you're not saying this, but I'm assuming, doing this a few 100,000 times, you filed for an administrative law judge a hearing and you're just waiting for your hearing date. Hopefully that's it. Yeah, if you're waiting 2 years, that's got to be it. So yeah, unfortunately, throughout the country, the hearings are taking about that long, unless you're like I did a video on this. The worst places in the country, like Savannah, Georgia was the worst, average of 22 months. But yeah, I would reach out to them and say, hey, when's my date? What's going on? And at the ALJ stage, I do recommend an attorney. Hopefully you have an attorney. You don't need one. You don't have to get one. But it's good to get one at that particular stage. I don't recommend one at the first 2 stages. Watch my video and explains why. But the ALJ stage, I do recommend. I always recommend a local lawyer that does disability, because they know the local administrative law judges and they know how to approach the case and all that kind of stuff. So yeah, good luck. Yeah, 2 years is way too long. So this is an example. It's going to get even worse. We're going to be here, this time next year, and people are going to say, I've been waiting 3 years. And again, this is people not getting their benefits and they're frustrated and they hate the system. And then when somebody comes in and Wall Street comes in, hey, we'll save it. We'll make customer service really awesome. And then, yeah, but at what cost? All right, let's see. My sister's still working full time, and she told me she has Medicare Part B as a primary and insurance through work as a secondary. Does that sound right? I was surprised she is paying for Part B. Yeah, I mean, you can do that. You definitely don't have to, but some people just have terrible plans at work and, crazy deductibles. You have to pay the first 5,000 or something like that. So if that's the case, yeah, it might be good to go ahead and get, Part A and Part B. But yeah, if the plan at work is just that bad, but if she works at some place and she kind of likes the health insurance, but she thought she had to sign up for Part B, because of secondary, primary, whatever the case may be. Yeah, that's not really relevant. It's whether you like that plan. Again, whether the employer has 20 or more employees, and it's through current work. It has to be through current work, not Obamacare, not retirement plan, not COBRA or anything. It's through current work. But if she's paying that $174 and she doesn't have to, then she can stop Part B and then pick it up again later when she stops working. Why is it that people are here because the advantages of the content, but won't hit the like button? Oh, it seems strange. Yes, please hit I can't see when people hit the like button on my system here. So please, yes. I can't see my own benefit online because I'm collecting survivor benefits. How do I find out? Yeah, they're continuously working on the system, Social Security, SSA.gov, socialsecurity.gov, and that's one of the once you file a claim and stuff like that, you can't get back in there for some reason. So yeah, they fix that sometimes, and then it gets unfixed. And now they're working on, everybody's getting that email where they say you need to go back in and reactivate your account and stricter security, which is a good thing. But yeah, for switching from survivor benefits to your own benefits, I would go online try, but yeah, you might not be able to do it. You might have to just do an old phone appointment. So schedule a phone appointment or an in-office appointment. Wasn't there quite a bit of fraud during the pandemic, at least for unemployment? I'm not against trying to fight fraud and get the people claiming who are not authorized out of the system. Yeah, there was quite a bit on PPP loans and all those. It seems like a bunch of politicians got those and then, got those canceled out. It's crazy. But yeah, not much for Social Security. Social Security is, obviously some people are, not receiving disability or are receiving disability that shouldn't. And actually, unemployment insurance is actually part of the original Social Security Act of 1935. So a lot of people don't know that, but it's not part of Social Security. Now it's administered by the states, obviously. Could not work anymore, age 55, claimed working disabled, retired. I only got half of my benefits, 1149, and got on the extra help, which they pay my premium and they helping me with probably prescriptions. Yes, extra help with prescription drugs. Thank you for adding that. Could not work anymore, age 55, claimed disabled, retired. So yeah, you filed for retirement benefits. Only got half your benefits, 1149. That doesn't sound right. Because yeah, when you file for disability benefits, your benefits are as if you kind of waited till your full retirement age. However, if you were 55 years old at the time and you went online and it said, hey, when you retire at, full retirement age, 66 and 6 months or 66 or whatever, you're going to get $3,000. But that is, what, 15 years in the future. What Social Security does, the system does, is they project in the future your earnings. So whatever you were receiving, the year before, the year before that, Social Security says, okay, this person is probably going to make probably about the same until they retire at their full retirement age. So we're going to project that forward. And that's how we come up with that $3,000 a month number. But at 55, then you immediately stop working because of your disability. Then you're essentially losing that, decade and a half of earnings. So that's probably why your benefits are what they are. But since you're only receiving 1149, yes. So hopefully you got Medicaid, and then Medicaid pays for your Medicare, which is called the Medicare Savings Program. They can pay for the Medicare Part B, the $174.70, and then you've got the extra help with prescription drugs. And then for people with Medicare and Medicaid, then I always recommend a Medicare Advantage plan, if it's right for you, and zero premium. I, as everybody that knows that watches my channel, I always recommend Medicare supplements, Plan N and G, but in certain circumstances, Medicare Advantage is definitely the way to go. If you got Medicare, Medicaid, if you're on, primarily use the VA, and there's some other situations as well. They denied my son yesterday, saying he didn't pay into it or work. He was approved in the past, so I'm confused. Should I appeal it? So I am thinking he filed for disability, because disability, you need two insurance statuses. You need to be insured for disability. That means you paid into Social Security at least 10 years, 40 quarters. And for disability, you also need to be currently insured. That means you had to have worked 5 out of the last 10 years prior to your disability. So possibly that's it. He is insured, but he's not currently insured. And unfortunately, yes, they will deny you if you're not currently insured. How to see survivor benefits, where to find it. Yeah, I've done a bunch of videos on survivor benefits, but you can collect survivor benefits as early as 60 years old, or actually early as 50. It's called disabled widows benefit. So if you're a disabled widow, you can collect disabled widow benefits from the age 50 to 60. And then at 60, just regular surviving spouse benefits, widowers benefits, same thing. Let's see. During the pandemic, I was denied disability a few times. They said I didn't do paperwork, etc. I had completed everything. Still excuses and denied. Wow, um, that's unfortunate. So yeah, if you're still disabled, unable to work, then I would definitely file, and maybe they can reopen. It's called the protective filing, that you say, hey, I'm going to go ahead and file. And oh, by the way, I filed a year ago, 2 years ago, and y'all dropped the ball, or whatever the case may be. You didn't treat me right. So maybe they can reopen it, use that as that date you first filed last year, 2 years ago, 3 years ago, as a protected filing date. So yes, I would definitely file and say, hey, can you go back? Let's see. I substitute cheat. Oh, okay. I think I already answered that one. Okay, going through the questions. I've been applying. I've been applying my Social Security age 62 until I never received any good response. So you applied for Social Security age 62 and never received good response. Yeah, to file for regular retirement benefits at 62, if you did it online, or phone appointment or something like that, it doesn't take that long. If everything is correct, they got your citizenship or your legal status in the United States, your earnings record is correct, is all that kind of good stuff. And again, it takes 20, 30 minutes to do the application and adjudicate it. So if it's been over, a week or 2 weeks or something, then I would definitely contact your local Social Security office that did it and say, hey, what's going on? I filed, and where's my money? Let's see. I'm 66, still working, and have insurance at the job. Can I file for Medicare? Yeah, if you want to, but you don't have to. If you have health insurance from work, current employment, and the employer has 20 or more employees, then you do not have to sign up for Medicare. But if you want to, absolutely. Some people just go ahead and sign up for Part A, because it's free. That covers your hospitals, and then wait for the B. But if you want to sign up for both of them, absolutely, absolutely. And then so you sign up for Part A and Part B, but Medicare has a lot of gaps. The biggest one is Part B. There's a 20% co-insurance. So if you go into if you go have a surgery that's $100,000, you have to pay $20,000 out of your pocket. So what people do is they get either a Medicare Supplement plan or a Medicare Advantage plan. And I've done a bunch of videos, and I've so many bad actors out there, agents, brokers, that I decided to put my own team together. So if you need help with Medicare, even Obamacare, even burial insurance, because that $255 just ain't enough. So let me put my little thing on there. Just click that little more help button there, and they can help you out. That all brokers and agents, they don't charge you anything for that extra assistance. But yeah, so you'll need to get a Medicare Supplement plan or a Medicare Advantage plan. Let's see. Are you able to get SSI from a transplant after 9 years of working after the transplant? Yeah, it doesn't matter what your disability is. Again, SSI is a welfare-based program. You're probably just talking about regular disability. But if whatever the reason is, if your disabling condition prevents you from working, or particularly working over SGA, which is the $1,550, you can 100% file for benefits. I have a Social Security number, but I don't have ID. I mean, not living in the U.S. I may get Medicare. Yeah, but Medicare doesn't work overseas. I did a video I've done a few videos on, there's a lot of expats, a lot of people moving overseas to, enjoy the cost of living overseas on their Social Security, and they debate whether to keep Medicare or not. And I always say I would keep it, because you don't know if you're going to come back. And if you cancel your Part B because you're like, oh, I'm going to be overseas and I'm never coming back. Invariably, I've done this for a few decades. People come back. Not all, but, and then they don't have health insurance in the United States, and they can't sign up for Part B until January, February, March, and then they get penalized 10% for every 12 months they did not have Part B. So yeah. WEP GPO, does it impact industrial disability? No. Yeah, Social Security doesn't. WEP and GPO, the windfall elimination provision, and the government pension offset. Yeah, that doesn't. Social Security doesn't have industrial disability, so no, because I don't know what industrial disability is. That must be some other industry disability. But WEP GPO is only Social Security related. When should I sign up for Social Security? 66 in March. Yeah, if you want to go ahead and start your benefits at 66, you can start at any time. But yeah, usually a couple 3 months in advance is plenty. Let's see. Gotta jumping around here a little bit. I am retiring in 3 months before fraud. Difference is only about $33 per month. Do you think that is a good decision? Yeah, nobody can tell you whether it's a good decision or not, because there's just too many factors. Do you need the money? How healthy are you? How, your genes, longevity in your family, tax differences. But yeah, most people, in that situation, they're like, I get 3 months of checks, if that's going to be what, $3, $4, $5, $6,000, and I'm only going to take a $33 a month hit. So you take that, if you're going to get $7,000 divided by $7,000 divided by 33, and usually takes you about 14 years to make up that difference. So yeah, get while the getting's good. Let's see. My sister's husband passed and was on retirement. She is 70 and was let go of her job unexpectedly 2 weeks ago. She just applied for spouse survivor benefits. Perfect. Good. So hopefully they treat you right and get your benefits started sooner rather than later. Take the cap off for both employees and employers. That will extend the solvency until the 2060s without any changes. Yes, that is my recommendation too. Yeah, it's the cap. I just did a video on this that plumber, electrician that's making $168,000, they pay FICA on all of it. But if you're making $28 billion, you know, you're not paying it on any of it, probably, maybe a very, very, very small amount because they take their money in different ways. So I just did a video on that one though. Let's see. Uh, Thank you. Let's see. She doesn't have a marriage certificate and was told she needs to file under his before she can file for hers. She just turned 70. Yeah, that doesn't make sense. She doesn't have a marriage certificate. She can get the marriage certificate. Just contact the local agency where they got married. Yeah, and so, but don't wait on that um, because she might not need it. Wait till you actually talk to someone at Social Security, and they might say, "Oh no, when he filed, he said he was married to her," and so you might not even need the marriage certificate. But don't lose benefits by waiting. But she's told she needs to file under his before she can file for hers. Yeah, that's incorrect. You can file for survivor benefits, and then yeah, and then years later. But it doesn't matter because she's 70. Her benefits won't go up. So she just turned 70, then she just files for whatever benefits are the most. So there's no use in waiting. So if survivors is the most, file for that. If hers is the most under her own, then file for that, whichever one is the highest. While working, I was told my retirement age will be 67 and a half. I was found disabled in 2023. Will my retirement age be the same or 62? Yeah, it's not 67 and a half. If you were born after 1960, your full retirement age for Social Security is 67. So, but you can collect early benefits at 62, which if you're receiving disability, yeah, no, don't even mess around with retirement unless you want to go back to work or something like that. Social Security website has a nice option for you to see an estimate of benefits if you stop working today or stop working next year. You can also change the amount you think you'll earn in the future years. Yes, yes. So you can do it manually as well. And again, you can just let the system kind of make their own projections, or you can plug in your own numbers. Can my sister apply for Medicare without Social Security being completed? What do you mean by Social Security complete? You can file, maybe this is what you mean. You can file for Medicare, just Medicare, restrict your application to just Medicare without collecting your Social Security benefits. So if she's approaching 65 and she wants Medicare, but she wants to let her Social Security benefits increase until 67 or 70, then yep, no problem whatsoever. It's a Medicare only, a high SMI claim, as we used to call it at Social Security. Or you can just do a high claim, just hospital insurance, and just sign up for Part A, or sign up for Part A and Part B. So, yep. Let's see. As a new citizen with a new name, do I need to go to change my name with Social Security? Yes, and congratulations for being a new U.S. citizen. We used to go to the naturalization ceremonies. We used to, about once a month, we used to go down to the local INS, and when they raised their right hand and they got their new certificate of naturalization, we had a little table there where we set up, and so we could change their names or update their citizenship. But unfortunately, offices can't do that anymore. They're understaffed, so you have to actually go into Social Security. But yes, I'd highly recommend going to Social Security, particularly because you change your name. Definitely, because your taxes are going to get messed up, because the Social Security computer system talks to the IRS computer system, and if your name is wrong, it might be an issue. Your Social Security number is going to stay the same; that won't change. But definitely go into the Social Security office with your naturalization, and much as proof as you can to connect the previous name with the new name. Usually it has it on the back of the certificate of naturalization. Yep, and update your citizenship and update your new name. Let's see. What if you haven't worked enough? Can you still collect Social Security? Yeah, if you didn't pay into it for 10 years, then unfortunately no. But if you become disabled very, very early, there's special considerations there. People that pass away very early don't necessarily need the 10 years, but there's also SSI, the welfare-based program. Let's see. Okay. Other questions here. They're saying in this lousy economy, our raise is going to be small. The company's folding like cards. Yeah, a couple of years ago it was pretty good, over 8%. But one of I believe that nobody cares what I believe, but the CPI, which is how they determine the COLA, is based on incorrect, or not incorrect, but it should be based on it's based on workers, younger workers, when it should actually be based on what the elderly pay for, well, more health care. And if that was the case, your COLAs would have been 2% more for the last 20 years. So instead of 8%, it would have been over 10%. This year would have been, over 5%. But unfortunately, yeah. But one of the political parties, they want to do that. So he had no choice but to retire because he was injured from getting ran over by a Harley Davidson. I go with him every day. Wow. Yeah, the early retirement. So watch my video. Please watch my video on uh, living on Social Security alone. Lost the title there for a second. And there's a whole bunch of different programs. Hopefully you can find something in there that's going to help them out. When you passed your full retirement age, where can you find your PIA? For some reason, I don't see it on the annual statement any longer. Yeah, your PIA is always your PIA. Your PIA is your benefit at your full retirement age. You're talking about DRCs, delayed retirement credits. It's basically 8%. So if you wait for 3 years until you're 70 and your benefit is $1,000, and therefore your benefit at your 70 is going to be $1,240. So it's 124% of your PIA. Additional plans don't cover cancer, and if you have chemo, constructive therapy, reconstructive surgery, etc., you wind up $1 million or close to it in overall charges. Yeah, that's why those Medicare supplements are always good. If you get like a Plan G or Plan N, even if you have $1 million, whatever surgery, chemo, then you pay $240, and that's it. You're done. I just turned 66. I only get $1,300 a month alimony. Why are they taking my Medicaid away? Yeah, that's a state thing. But if all you're receiving is $1,300, then yeah, that's strange why they're taking your Medicaid away. I know they're kicking a lot of people off of Medicaid throughout the country after the pandemic, but yeah, if all you're getting is $1,300, are you also getting Social Security above and beyond that? If you're getting any money of Social Security, then yeah, $1,300 plus Social Security, that's probably going to put you over. Yep. Many doctors just told him he should be in a wheelchair. Oh, let's see. When are they going to stop taxing Social Security? Yeah, that's a good question. They just started taxing it in the 1980s. They made that in order to increase the solvency. And it was 50%, and then they raised it a few years later to 85% of your Social Security benefits are taxable. But if all you're receiving is Social Security, then most people don't pay taxes. It's usually all the other stuff, 401ks or work or whatever the case may be. When are they going to make immigrants give the money back? Not sure what money. Illegal immigrants pay, it's estimated $27 billion. They donate $27 billion to the trust fund every single year. So thank you very much, because they're not going to get that money back because they're not US citizens or in the country legally. So they're paying money into Social Security. It benefits us, but they're not going to get it back. So definitely take the cap off, including Musk, Koch brothers, Bill Gates. Yeah, that's it's strange that there's a cap. There's no cap on Medicare. They took the cap off of Medicare in 1994. So, those rich, super rich, they pay. Well, they probably don't pay because again, they don't probably pay FICA taxes. They take all their money in capital gains or something like that. And they, you know, they've got those expensive accountants. So if 65 with employer insurance and say 3 months down the road unable to work anymore, will I get a penalty for signing up for Part B later? No. If you're 65, you have employer health insurance from current work, and your employer has 20 or more employees, you do not have to sign up for Part B. And then 3 months down the line, or 6 months, or a year, or 10 years down the line, once you stop working and stop receiving insurance from current work, then go ahead and sign up for Part B. And yep, it's no penalty whatsoever. Let's see. How come I was told 2 years ago my ex's Social Security would be only 30% and I wouldn't get any? Now I am told I get 50% and almost $600 more on top. Yeah, when you file for spouse benefits, living spouse, surviving spouse, your own benefits, they're reduced. When you file early, then that benefit is reduced. 62, it's basically 30% reduction. And then as once the closer you get to full retirement age, the closer you get to the full 50%. 18-year-old son is autistic. We filed for disability on his behalf in September. Still haven't heard anything. I would definitely call. Don't call the local Social Security office because your claim is not in Social Security. What happens is you file for disability at your Social Security office, and they send it up what's called a DDS, Disability Determination Service. It's a state agency that makes the medical determination. So contact them. That's where your case is, and say, "Hey, what's going on?" Just call them up and say, you need to speak to the DDS examiner that's handling your son's case, and hopefully you're the representative payee, and so they can actually talk to you. Let's see here. Big changes in healthcare next year. Many on Medicaid are getting cut off, doing a lot of crazy things. Yes, next year is going to be the big year for particularly Medicare Advantage, Medicare Part D. It's the biggest one in a long, long time. A bunch of changes. Medicare is going to be paying those health insurance companies less. They have to send out a mid-year, hey, you've got dental and you have been using it, and there's that prescription drugs catastrophic went down from 8,000 this year to 2,000 next year. So there are a lot of changes. So if you've never checked your Medicare Advantage plan, those change every single year, and you're like, no, I've had mine for 3 years. No, you haven't. You've had it now for 7 months, because every Medicare Advantage plan in the country goes away on December 31st at midnight, and then a new one comes in. You might have the same card and might be your same doctor and still zero premium, but a lot of stuff, the hidden details, these insurance companies don't get to be billion-dollar insurance companies because they're dumb. They are going to change the details, and next year it's going to be humongous. Yes, a lot of changes. So it's really important that you check your Medicare Advantage. So get with your broker or agent. And if you don't have anybody you know and trust, again, click on that little link I put there, and you can click on it. Says one-on-one Medicare help. And then there's an option where it says, hey, I'm good now, but put me on your list for October. And when the new plans come out in October, we'll have somebody that's licensed and contracted in your state to go over all the plans and give you all your options. See if your plan is still the best one for next year. Let's see. This is fear mongering. Alert: Social Security benefit cuts. I realize you want us to click you, but make everybody. Yeah, so I was afraid people were going to say that. No, it's people that are not able to receive their benefits because they can't get into it, and they get frustrated, or they're given wrong information. All you have to do is watch. Everybody that watches on here regularly can tell you, all the people, read all the comments of all the people. Oh, I didn't know I was entitled to that. Oh, I didn't know I could do that. I didn't know this more money was out there. I didn't know I could receive disability and survivor benefits. I didn't know I could receive survivor benefits first and then return. All of that is essentially people losing money. And why are they losing money? because they're not getting this assistance they need from Social Security to help them get the benefits they need. And so when that service, that help continues to diminish, that's benefit cuts. And it might not affect you, and hopefully it doesn't, but I guarantee you, we found tens of millions of dollars for people out there. So um, I would respectfully disagree with your comment. My dad never going to raise baby, send him a letter telling him he was getting a raise for 1 month and they pulled the money off of one. Yeah, not sure what that question is. I'm going to be calling to discuss my overpayment situation. Well worth Dr. Weir's fee. Yeah. 99% of my help is free, but I do offer private consultations. And if you're interested, again, click that little button there, and I can definitely help you out. All right, I've got tons of other questions here, but we're running out of time. Let me answer one or two more questions of people I have never seen here before. I don't think I've seen Edwina here before. If the collection base for the fund was based, oh, okay, that's I think answering somebody else's question. Let's see here. Would you mind inviting guests to talk about burial insurance, please? Yeah. Social Security, I've issued hundreds of thousands of those lump sum death payments, the $255. It's been $255 for decades, and nobody's ever, yeah. So that's another reason I put together a team that can help you with burial insurance. So if you don't have money for burial, then burial insurance, also called final expense, is highly recommended. But if you've got, other money, 401ks and stuff like that, then you don't really need it. But please, it's not for you, it's for the people that you leave behind. Because yeah, I've been on the other side of that table for people, taking the survivor benefits, and they're like, the funeral just cost $10,000 and you're going to give me 255. Like, yeah, sorry. So, but I've also had people that get the burial insurance, and they say they already bought a plot and everything like that, but they say, yeah, when you get the money, take the whole family to Hawaii. They're, that type of people. And it's like, yeah, have a party on me. So I thought that was interesting. No matching Social Security or Medicare, no unemployment, no workers' comp, no vacation, holiday or sick pay, no insurance and vacation. Oh, okay. Let's see. All right, let me try one more question here. Is Medicare always available at a certain age, no matter how much money you have? Yes, Medicare is always available at 65 years old, Part A and Part B. If you are disabled or end-stage renal disease, then it's available there too. For disability, you get Medicare automatically after being on disability for 24 months. And again, same type of thing. You don't have to sign up for it if you have health insurance from your work or your current work or your spouse's current work and you're happy with it and all that kind of stuff. All right, this will be the last one. I am not in touch with X and never remarried after 20 years of marriage. If anything happens to him, God forbid, will Social Security notify me? No, since I will be on my Social Security, which is far less than his. No, they will not notify you because they, don't know that you were married to him or interested or whatever the case may be. But if you're 60 years old, so you're entitled to survivor benefits. If that benefit is higher, what I would do if you don't keep in touch with him, just call Social Security every now and then. And you don't need that person's Social Security number. If you have it, great. But if not, call Social Security and give them his name, the date of birth as well as where he was born, and they can find the Social Security number. Super, super easy. And then say, any survivor benefits, or I want to file a claim for survivor benefits, and they'll say you can't file a claim for survivor benefits because you ain't dead yet. And then you say, okay, all right, call you again in 6 months from now. So, and then yeah, once that happens, then you can go ahead and file a claim for survivor benefits. Oh, Lisa, $5 support. Thank you very much. I'm hearing a lot about spousal benefits possibly being cut by Congress. What is this actually about? No. there are many proposals out there. I've talked about a few of the proposals before, but nothing in the works right now. Anytime something actually is voted on or passes committee or anything like that in Congress, that's why I'm here today, because something just passed. But I always watch out for this. So if there's anything actually happening by your representatives in Congress, then I will let you know. But right now, yeah, any type of spousal benefits or anything like that cut is just proposals by this committee or study committee or political party or whatever the case may be. So you're good. So don't worry about that for right now. If I see anything, I will bring it to you. All right. I see CSRs here. SSA CSRs love to do the put you on hold, then hang up if they can't answer your question. Huh. A CSR is customer service representatives. They are kind of the front line of Social Security. They're generalists, the lowest paid, hardest working, and unfortunately, yeah, sometimes they're not great. Social Security, they're hiring a lot of new people, but it takes 2 years to learn the job. And that's terrible that you ask them a difficult question and then they don't answer it. Yeah. What a pain in the butt when you wait on hold to talk to them and it can be hours. Yeah, that's unfortunate. That is unfortunate. So next time, call up and say, hey, yeah, how's it going? It'll be nice. And hey, what's your name? Bill? Hey, Bill. All right, well, here's my question. And then if they hang up on you like that, call up and say, hey, hopefully get someone else and say, I was talking to Bill and he hung up on me. So yes. And please do that. Please do that. When I ran my office, I loved to get complaints because it was usually on the same one or two people. And, because they're federal employees, it takes a little bit to fire these. But I fired a lot of them. And so when you complain, that helps out the district manager because they can use, those one or two or three or four to get that person sent on their way. And I have sent many people on their way, and it was because y'all complained. So please do it. All right. I think that'll do it for today. And if I didn't answer your question, I apologize. We're running out of time, but I will be back again tomorrow. And then jump on first thing. And this is how I do it. I talk about a topic of the day for about 5, 10, 20 minutes or whatever. And then I open it up to questions and answers. So come on back tomorrow.